HIMSS 22 is just around the corner, and as usual, there's going to be a lot of hubbub and a lot of press releases coming out in advance of the event. So today we're going to be talking about what our team will be looking for at the event and what we think the rest of the community should be paying the most attention to. Welcome back to the Chilmark Research Channel. My name is John Moore, and I'm the Vice President here. Before we jump into things today, please be sure to subscribe to our channel to receive notifications when we post new content. And if you like what you see here today, leave a comment and hit the like button. Today I'll be providing a quick overview of the top 5 things to be looking out for and themes to be following at the big event down in Orlando. As you're probably aware, HIMSS is the mecca of buzzwords for our industry. So I'm going to try to avoid as many as I can, but as you know, talking about the big trends and themes, it's unavoidable. The first thing that our team will be looking at is how organizations are actually enabling the shift to value-based care. As most of you are likely aware, a lot of healthcare IT was initially developed for episodic care based on a fee-for-service model. However, Centers for Medicare and Medicaid, as well as a number of private payers, have been trying to shift everyone over to value-based care or performance pay models of reimbursement for their services. So what we'll be looking for is how well these legacy systems, which were originally established as systems of record for siloed, independent organizations, are trying to modernize their offerings to better meet the new needs of a longitudinal, comprehensive care plan. The second theme that our team will be paying very close attention to is this idea of the new digital front doors to care. Yet another buzzword, but it's very important because we see these new offerings as potentially supplanting some of the traditional population health management capabilities that were baked into these bigger PHM platforms. These solutions are largely about improving the convenience for both providers and patients when the patient is trying to receive appropriate care. This way, no one is wasting time on unnecessary care and unnecessary referrals from one clinician to another until the patient finds what they actually need. So part of this is about convenience and accessibility, but it's also about identifying where patients are so that you can actually meet them in their lives and get them the care that they need. So pay attention to a lot of these new solutions that are coming out as part of electronic health records, as well as some other companies like Buoy Health and the triage/navigation organizations that are helping to route patients more efficiently using artificial intelligence and machine learning. So, number 3, we'll be building on that last mentioned topic of artificial intelligence. As you've probably noticed, AI is everywhere these days. It is in all enterprise industries, it's in consumer industries, everyone's talking about it. It's hard to throw a stone without hitting a news article about it. In healthcare, however, there is still a significant amount of resistance to clinically derived AI because of the issues around black box algorithms and just general trust with these solutions that have proven in the past to be problematic and introduce unforeseen problems to the actual care delivery process. So as we look at AI and machine learning, one of the first things you need to do is evaluate whether or not it is actually true AI or if it is a rudimentary rules engine. From there, you definitely want to press people on whether this will be a black box or an open algorithm, because if anything is clinically oriented, it needs to be open. People need to understand the audit trail of how the AI came to the conclusion and recommendation that it did. And then finally, just see if it actually makes sense to do something with artificial intelligence for that solution, or if the organization is just jumping on the bandwagon to have a buzzword to cling to with the rest of the industry. The fourth theme that our team will be paying attention to at HIMSS this year is the concept of platformification. To learn more about what platformification is, please tune in to a recent podcast that we released that featured our analyst Jody Rank speaking with Vince Corradis and Randy Williams about the idea of enterprise software platformification. We'll link to this podcast in the description, so please find that down below. We saw this idea of platformification on very heavy rotation in our conversations at HIMSS 21, and we only expect this trend to increase in its momentum as we enter HIMSS 22. Also, based on a number of the conversations that we've had throughout the year, just for our research processes, a number of companies are planning on announcing new models and new ways of delivering value to their clients at HIMSS this year. So definitely pay attention to what organizations are doing that's unique and different in this way of thinking about platforms in healthcare. And last but not least, our final theme that we'll be paying attention to is this shift towards more hospital-at-home services. What we saw during the pandemic was an increase in need for these types of solutions and these types of care models as more clinicians and clinics tried to keep patients out of the care setting of the actual four walls of the doctor's office because of the different surges that we were dealing with during the pandemic crisis. Now that we seem to be on the back end of that, we still expect to see a lot of these models retain their interest from both patients and clinicians to improve the patient's quality of life, especially in later years, as well as reduce the amount of burden on various hospital beds and inpatient treatments. So what you want to look for when you are talking to these vendors and looking at the different new solutions to enable hospital at home is whether or not these solutions provide a good take on how to feed the patient data back into the primary electronic health record and actually facilitate a true longitudinal patient record. Are these companies developing their own remote patient monitoring tools, or are they working with a partner? Are they collecting true biometric data, or are they just having nurses go to the house and enter all the information themselves? What exactly are they doing to streamline and facilitate these new models of care? These are all questions that have yet to be worked out as we think about these integrated hospital-at-home models. We hope you found this video today informative, and I hope that it helps you with your meetings and planning for HIMSS. If you'd like to receive live updates from the event, please be sure to follow us on social. If you see anyone from our team on the floor or around HIMSS, please be sure to come up and say hi. We'd love to talk to you. If you liked today's video, be sure to like it and leave a comment and share it with some friends if you think it'll help them out. We look forward to seeing you soon.